will discuss only about the carbohydrate part, how carbohydrates are digested. Okay. So we know much about carbohydrate digestion, like there is one enzyme called amylase, which is secreted by the 3 pairs of salivary gland, and it is also secreted by the pancreas. Is there any other amylolytic enzymes we know? Any other? So what is it specific for? Alpha (1,4) glycosidic bond. Alpha 1,4 glycosidic bond formed between two glucose units. But it cannot cut. It cannot digest disaccharide. Polysaccharide it can digest. What type of polysaccharide? What type of polysaccharide? Alpha-amylase can work on yes or no? Yes or no? Mucopolysaccharide, can it cut or not? It's a polysaccharide. I said no, polysaccharide it can cut. So can it digest? Amylase digest করতে পারে না পারে না? Cellulose, sure. Dextran, dextrin, no? Dextrin is nothing but a portion of starch, partially digested portion of starch. Starch has two components, you know, right? What are those? Right? When amylase is cleaved, lesser molecular weight called dextrin. Right? First it is called Erythrodextrin, then it forms Achrodextrin, means further smaller, so no color. Starch gives deep blue color. With iodine, you add a little bit of amylase, add pinch of sodium chloride and wait for some time. See, the color will change from deep blue to red and then colorless. The red color is due to formation of erythrodextrin, the shorter version of native amylose. Amylopectin has no role in the formation of color with iodine. Hold on. So basically we cleave alpha type of bond, not beta type of bond. The beta type of bond is present between cellulose. So it cleaves between only that too not on disaccharide. Cellulose contains beta 1,4 glycosidic linkage. Beta we cannot cleave, this one cannot cleave. For this we require beta amylase. It has another name. Right? Can we produce beta amylase? No. No mammals can produce beta amylase, but few mammals which are called ruminating animal. Ruminating animal means they can regurgitate the food, half digested and then chew, then again swallow. Whatever it is. So they in their cecum they have bacteria, normal fauna, bacterial population, which can produce beta amylase, and they produce small amount of free glucose which can be absorbed when recirculated within the gut. But the process is very slow and inefficient, so they produce very less energy. At small intestine, we have these type of cells or cellular projection. Right? What do you call this? Bolo? Right? In between, there are opening for glands which secrete certain digestive enzymes within this small space. This space is actually devoid of most of the portion of the lumen. The lumen consistency, whatever is there, it is not found within that space, small space. So within that small space, these enzymes are secreted. Four enzymes, okay? So the disaccharide, the polysaccharides are cleaved depending on the nature of the bond. Whatever undigested goes in the form of stool, and here the disaccharide part is cleaved by respective enzyme. So for lactase will cleave lactose to glucose plus galactose. Maltose alpha-1,6 glucosidase activity. It has alpha-1,6 glucosidase activity. So this cleaves these are the bonds which are cleaved by these digestive enzymes. So wherever this kind of bond is present, sucrase will cleave. Wherever alpha-1,6 bond is there, isomaltase will cleave. Alright? It can cleave both in the middle and from the either side. So mostly disaccharides are digested in a very close compartment. Why? Why so? Why, like other amylase? Amylase is found here, in a lumen, it's bulk. But these enzymes are secreted here, inside these spaces. Why? Any reason is there? Bolo? That is so the role of villi. Why villi? Because villi increases surface area. Here the process is to prevent compared to starch or disaccharide, monosaccharides are highly osmotically active molecules. If more monosaccharides are available free in the lumen here, then what will happen? All water and then what will happen? If all water comes to lumen, what will happen? Frequent visit to bathroom, coming and going, liquid stool, because anal sphincter is unable to hold liquid pressure, unlike urinary sphincter. Two sphincters are different. Urinary sphincter can hold liquid pressure, but anal sphincter cannot hold liquid pressure. That is why the small amount of liquid generated, immediately it goes into rectum and it is flushed. And if you do not go rush, then what will happen? Big problem. So that is why frequent defecation of liquid stool will appear. Now, this, to prevent osmosis, this pattern is followed. So remember, only monosaccharides are absorbed. In no other form carbohydrates are absorbed, not even disaccharides, only monosaccharides. Fine. So thus, when monosaccharide means mostly what? Glucose. Because our food is mostly carbohydrate rich, which is glucose rich. What comes next? Fructose. What comes next? Galactose. What comes next? Few pentose sugar. Availability of the monosaccharide, if you see in our diet, then glucose greater than fructose greater than galactose greater than pentose sugar. So we have mostly transporter named after glucose. Don't write, just see. এখন কি লিখো না, এখান থেকে এই কোশ্চেনটি আসে describe glucose transporters, different type of glucose transporters, explain one of them. Now there are 11, 12 glucose transporters so far discovered. But I would request you to, or urge you to, remember the 6. Okay. 5 is easy. GLUT 1, 2, 3, 4, 5. Number 6 is little different. SGLT. SGLT 1 I have mentioned, SGLT 2 I have not mentioned, I will tell. SGLT 1 and 2, or you can say SGLT. Alright? So 6 you have to remember. Now what you have to remember? Where is it located? How it is stimulated? Is there any effector molecule which can stimulate, increase the, and what is the predominant sugar it transports? Though it is named after glucose, doesn't mean it always transports glucose in the same rate. Not in case of all transporter. There are several which will transport other than glucose. Because our food contains other than glucose many sugar. Galactose is there, pentose sugar is there, fructose is there. So we need separate transporters for those. But nature has given a glucose transporter which prefer those sugars over glucose. So them also we have put in the same series, GLUT series. So GLUT 1, you see insulin sensitivity. Which one is insulin sensitive? Only one. GLUT 4, huh? What does it transport? Glucose. What is difference here? GLUT 5, it transports fructose. It prefers fructose over glucose. Very good. So you remember these two. 4, insulin sensitive, nothing else is insulin sensitive. 5, transport glucose, fructose. Now the location of these. 1 is present in all numbers, so 1 is present in all tissues. It's called ubiquitous. It's called ubiquitous. Ubiquitous means omnipresent. Right? Starting from brain to tissue, everything. Number 2 is mostly GI, liver, etc. And obviously brain. Number 3, other tissues than GI, pancreas, etc., etc., luminal phase, basolateral phase, and then number 4 comes. Number 4 is important. See, muscle and adipose tissue. That does not mean that muscle and adipose tissue has no other transporter. They have, but less in number. Whereas brain has got all sorts of glucose transporter. Why? Because brain cannot survive other than glucose. All forms are available in brain. Maybe small amount, maybe big amount, but this there. Okay? Except GLUT 4 is very small amount, but GLUT 4 is present in a big amount where? Muscle and adipose tissue. So in diabetes mellitus, which organs will be affected? Which organ will be starving? In diabetes mellitus there is no insulin. So which transporter will be ineffective? GLUT 4, that means skeletal muscle and adipose tissue. That is why in diabetes mellitus people will become thin, because adipose tissue is not getting food. The muscle undergo wasting, muscle protein degeneration. Correct? GLUT 5 on the other hand, fructose. There is only one body fluid which is rich in fructose. Can anyone tell? Semen, correct? So where do you find GLUT 5? Possible places? Testis, ovary. Ovary. Ovary ke bollo? It's too much. This is the height of gender equality. কি বলছি তো? So it is what? Testis. Because it has the only body fluid, it is the only body fluid where fructose is present. As a matter of fact, fructose content is measured as a good health of semen in the semen analysis. If fructose content is less, then there is less possibility the person can produce child. It can have infertility. Lastly comes SGLT. A stands for sodium. Sodium dependent glucose transporter. Sodium dependent glucose transporter. It has two forms. One is SGLT1 and this is SGLT2. SGLT1 is present in small intestine and renal tubules. SGLT2 is present in renal tubules, not in small intestine. SGLT has two isoforms, 1 and 2. 1 is present in small intestine, 1 I small intestine, 2 is present in renal tubules. What is the outcome of this discovery? Drug of choice for diabetes mellitus. Right? This dapagliflozin type of drugs, they inhibit SGLT2 or SGLT2. So renal tubule cannot reabsorb glucose. What will happen? The glucose, excess glucose will be excreted through urine. It will cause glycosidia. Normally glucose is not present in the urine, but in this patient who are having very high level of blood sugar, we can get rid of blood sugar by excreting them. How? Just by inhibiting SGLT2. Glycosidia হয়ে যাবে, বেরিয়ে যাবে. Obviously, it has got some side effects, the indications where to use or not, that we'll see later. Now, this is a glucose transporter, how it works. Most of the glucose transporters are passive, not active, does not require energy. They transport glucose like this. Diagrammatic representation. The glucose enters into the transporter molecule, then they change from T to R state. The R state, then they release the glucose, they become again T state, like that. It will go on. Like from here to here, like you will catch here and then push it this side. This is a membrane. Outside there is a glucose. You will put it like this, and then this side will open. You will hold it, and then this side will open. The glucose will pass this side. That's all. So they will make an inert space where a charged molecule like glucose can cross the uncharged or non-polar lipid bilayer membrane. Now, this is a diagrammatic representation of SGLT1. SGLT1 is a predominant glucose transporter involved in the glucose absorption after taking food from the small intestine. How often you feel like adding salt to rice when eating? It is a must, correct? If you are taking chapati and all, fine. But if you are taking rice beans, you have to add salt. Who decides that? The evolution decides that without salt, this will not function. It sends a taste sensation to your brain. Take some salt. That's why in order to have low glycemic index of the same food, or to reduce weight, to reduce absorption of less glucose, to reduce absorption of glucose from the gut, the doctors advise not to, or dietitians advise not to take excess salt. The salt which is normally present in the food is sufficient for our survival. It is our habit through thousands of years as a part of evolution that without salt, glucose will not be absorbed properly. So we add more and more salt, which is not good for our health. So this sodium is absorbed along with glucose molecule. Both occur from higher to lower concentration. What do you call this kind of transport? Synport. S-Y-N-P-O-R-T. Synport. Same direction along the concentration gradient. Along the concentration gradient, high to low. But problem is, inside the cell and outside the cell, what is the concentration of sodium? Outside concentration of sodium. Outside the cell is 135 to 145 milliequivalent per liter. Inside the cell, sodium concentration is 3.5 to 4.5 milliequivalent per liter. 3 to 4.5 milliequivalent per liter. Very low. Why? Because there is another transporter molecule here which will throw sodium outside and pull potassium inside. Sodium লিকুইড মানে তুমি ধরে নাও তুমি মেট্রো স্টেশনে ঢুকছো, মেট্রো স্টেশনে যাচ্ছ, মেট্রো ধরবে, ঠিক আছে? তাহলে মেট্রো যে গেটটা আছে সেটা তোমাকে তখনই রিকগনাইজ করবে যখন তোমার হাতে মেট্রো পার্টিকুলার টিকিট থাকবে। তোমার কাছে যদি পুরোনো টিকিট থাকে হবে না, তাই না? তোমার যদি কম দামি টিকিট থাকতে হবে না। তা তুমি যদি সোডিয়ামের জায়গায় পটাশিয়াম নিয়ে যাও হবে না, ম্যাগনেসিয়াম যাওয়া হবে না, খালি সোডিয়াম থাকলে ওই গেটটা খুলবে, সোডিয়াম ঢুকবে, সঙ্গে গ্লুকোজ ঢুকবে। গ্লুকোজের সঙ্গে সোডিয়াম ঢুকছে না, সোডিয়াম ঢুকছে বলে গ্লুকোজ ঢুকছে। যার জন্য যখন ডায়রিয়া হয়, ডায়রিয়াতে যখন আমরা ওআরএস দিই, ওআরএস মধ্যে কি থাকে? পিঞ্চ অফ সল্ট অ্যান্ড হ্যান্ডফুল অফ সুইট, তাই তো? সুগার কেন দেওয়া হয়? উইদাউট দ্যাট সল্ট ইট উইল নট অ্যাক্ট, ইট উইল নট এন্টার। তুমি যখন গ্লুকোজ দেওয়া হচ্ছে স্যালাইন, তখন সেটা অবশ্যই এটা তোমার সোডিয়াম করে থাকতে হবে। সোডিয়াম করে না থাকলে সেই গ্লুকোজ অ্যাবজর্ব হবে না। তো পেশেন্টকে তুমি শুধুমাত্র, কারণ when the patient is starving, he is not only depleting his glucose and fat and carbohydrate and protein, no, he is also depleting its minerals. So he should be always replenished with the minerals. Replenishment minerals is more important than glucose for a dying patient, starving patient. For a starving patient, if you give them a lot of food, biryani and all, he will die. After 15 days or 20 days starvation, if you give biryani, he will die. You have to give low glucose content, high mineral supplementation. Then slowly you must increase the glucose uptake. It is secondary active transport. Why secondary? Because this sodium gradient is dependent on this pump. Inside the cell, the sodium concentration is less, so its pump is always pumping out sodium out and potassium in. 3 sodium out, 2 potassium in, and it is occurring by the expenditure of ATP. So if ATP is not there, this will not function. If this doesn't function, then inside sodium concentration will increase. When it will increase, it will become equal to that of the outside of the cell, and sodium gradient will no longer be present. So what will happen? Glucose cannot enter. So to make the glucose enter into a cell, we need to maintain sodium gradient. To maintain sodium gradient, we require energy. Means we need money to bring money in. You invest little, earn more. You don't invest, don't earn. Money brings money. ATP brings ATP. correct? That is why this transport is also called, sit down, secondary transport. Now see the location of GLUT2. I said it is present in intestine. Which side? The basal side. This is the intestinal mucosal cell. This is luminal side and this is basolateral side. The basolateral side contains GLUT2, which transports only glucose across the concentration gradient, nothing else. Because in the blood, glucose is less, transported. It is insulin independent. It has low affinity. Low affinity means why? Km is high Km. That means when it will activate when there is a lot of glucose inside the cell. There is a lot of glucose in the cell. Why? Because sometimes the blood is also full of glucose soon after taking the food. Then immediately it will stop transport. That we don't want. That is why we have kept the Km value of GLUT2 very high. So that at any concentration of the blood glucose, it will enter. See, GLUT5, it transports fructose, prefer fructose over glucose. Good. But how long? How far? Just for entry to the mucosal cell. Inside the mucosal cell again, which one comes? GLUT2. Correct? So which one is more important? GLUT2. Without GLUT2, it will not reach blood. Just go through this. If you can understand, don't require. Just remember the structures, na? This one, this one and this one. These two are important. This year only they asked this question. Describe the structure of glucose transporter. Now, GLUT4, go through this. Put it GLUT4, as I mentioned, it is the only glucose transporter which is insulin dependent. And what is the function of insulin here? These transporters are nothing but proteins. They are synthesized within the cell on ribosome, beaded ribosome. From ribosome, it is targeted to that particular region where it's supposed to be present. Say for example, for this glucose transporter, it has to be transported to membrane. It must not stop its journey anywhere between membrane from ribosome. It must not go to mitochondria, it must not go to Golgi body, not Golgi bodies, say any other lysosome or any other substance. It can be stored for the time being in a pouch called vacuoles, in a pouch of Golgi body. Where Golgi body, the portion of Golgi body separated is called vacuole or vesicles. So these inside these vesicles they can be present. But they need some stimulation outside, from the outside of the cell. Yes, now insulin has come. These vesicles will pop up in the outer surface of the cell and express the transporters on the membrane. They were inside in the vesicle. In presence of insulin will trigger a stimulation and they will proximate to the cell membrane and then they will mix with the cell membrane because both are lipid in nature and they will express themselves on the surface of the cell membrane. Now they are exposed to the luminal side, now they can, or to the blood side or interstitial side, they can absorb glucose. The theory is very simple. Is it blood from which our cell gets glucose? Is it blood from which our cells get glucose? আমাদের সেলগুলো কি ব্লাডের থেকে গ্লুকোজ পায়? কার কার মনে হয় হ্যাঁ? হাত তুলো বড় করে। মাত্র 5 জনের, 6 জন, 7 জনের। ব্লাড থেকে গ্লুকোজ পায় না, কোথা থেকে পায় তাহলে? না, ব্লাড থেকে পায় না। A part of blood flows in the form of lymph. A part of lymph flows in the form of interstitial fluid. It is the interstitial fluid which envisage, যেটা আমাদের টিস্যুকে envisage our tissue. Interstitial fluid. So it must come from blood to lymph to interstitial fluid before entering to the cell. So we receive all cells, we receive the nutrients from the interstitial fluid. Blood directly cannot give. Now you wanted to write, you write this glucose transporter. This is GLUT1, class 1, erythrocyte, brain, ubiquitous. Major transported sugar is glucose. Present in skeletal muscle, yes. Present in white adipose tissue, yes. Correct? 1, 2, 3, 4, 5, 6. GLUT1 এর দেখো 6টা লেখা আছে। GLUT1 দেখো দেখো লেখো, নাহলে ভুলে যাবে। বইতে দেওয়া আছে এগুলো সবই। You have to memorize this table. Only the portion which I am telling you to asking you to memorize, you memorize those portions. That's all. লেখ, ছবি তুলিস না, ফটোগ্রাফার নো, স্টুডেন্ট তুই। পরীক্ষা লিখে দিতে হবে, পরীক্ষা লিখে দিতে হবে, লেখো। So GLUT1 found in erythrocyte, brain, and it is also ubiquitous everywhere. Is it insulin sensitive? No. What is the major carbohydrate to transported by this transporter? Glucose. Whether it is present in skeletal muscle? Yes. Present in adipose tissue? Yes. GLUT2, liver, pancreas, intestine, kidney. তাই না? আরো ভালো হয় যদি ইন্টেস্টাইনের পাশে লিখে রাখো বেসোল্যাটারাল সাইড, বেসোল্যাটারাল সাইড, মনে থাকবে। এই চ্যাপ্টারের এইটাই মনে রাখার, আর কিচ্ছু মনে রাখার না। দিস ইজ সো ইম্পর্টেন্ট, থ্রু আউট ইউর লাইফ ইট উইল বি রিকোয়ার্ড। Transporters throughout your life. GLUT2, insulin insensitive, glucose low affinity, fructose preferred? No. GLUT3, brain? No, almost no. Means medium, small amount, minute amount. GLUT4, heart, muscle. What is Watt and Bat? Watt and Bat? Anyone? Watt and Bat? Very good. White adipose tissue and brown adipose tissue. Why white adipose tissue is white? Adipose tissue থেকে আরবিসি থাকে? আরবিসি তো ব্লাডে থাকে রে। কি বলছিস তুই? বাঘের মাথায় কবে থেকে শিং আসলো যে ছোট বড় হবে? ছোট বাঘ ছোট শিং, বড় বাঘ বড় শিং। হ্যাঁ, কি বলছিস? বস বস বস, এটা ওই পোস্ট মিলের এফেক্ট। জল টল খা, বসো। The brown and white color is not, it's due to presence of number of mitochondria. The brown adipose tissue is more metabolically active compared to white adipose tissue. The brown adipose tissue is not visible in naked eye, and whatever adipose tissue we see in naked eye, they are all white. The brown adipose tissue is found in the lining of the inner organs. That means unless you cut me out open, you cannot see. What makes brown? Mitochondria membrane is rich in protein. Mostly other plasma membranes are 60% lipid, 40% protein. Mitochondrial membrane is just opposite, 60% protein and 40% lipid. Proteins are colored. Proteins can be dyed, can be stained. So the mitochondrial membrane gets stained. Hence, they look dark under microscope after staining, not normally naturally. Naturally, if you see, white and brown adipose tissue look same. Only location is different. They look alike. But after staining under the microscope, brown adipose tissue become brown adipose tissue. Right? Right. Yeah. GLUT 5, intestine, testis, kidney, no, yes, yes. So see, in adipose tissue and muscle, which all are present? 1, 4 and 5. 1, 4 and 5. 2 and 3 are not present in muscle and adipose tissue. কেন বলো তো? They are not aligned with blood vessels. They receive from the interstitial space. The blood vessels receive glucose from luminal basolateral side of the lumen. They are not exposed to those organs where GLUT2s are present. So GLUT 2, 3 is not required, but 4 and 5, they are present. 4 is maximum in number. Alright? লেখা হলে বলবে। হয়ে গেছে? এই কটা হইলে? হয়েছে? তাড়াতাড়ি কর। Any questions so far? কোটা 11 লিখতে বলিনি তো আমি 1 2 3 4 5 আর is GLUT আরে মহা মুশকিল তো এই ইউনিটে লিখেছিলাম পাগল নাকি হ্যাঁ এই ইউনিটে রেখেছিলাম হলো এবার একটা কথা এখানে বলে রাখি বলবো না তুমি অলরেডি জানো ল্যাকটোজ ইনটলারেন্স জানো হ্যাঁ জানো তো বাহ তাহলে পড়াতে হবে না কারা জানো না আচ্ছা যারা জানো না তারা যারা জানে তাতে জেনে নি ঠিক আছে ঠিক আছে আজকে এই পর্যন্তই কোনো কোশ্চেন থাকলে জিজ্ঞেস করো এখান থেকে বড় কোশ্চেন বলতে এই টেবিলটা মুখস্থ করবে 3 রকম গ্লুকোজ ট্রান্সপোর্টার ছবি দেওয়া আছে একটা হচ্ছে কো ট্রান্সপোর্ট সোডিয়ামের সঙ্গে SGLT1 GLUT2 আর সেকেন্ডারি অ্যাক্টিভ এই 3টে ছবি আঁকবে 3 ডায়াগ্রামস GLUT1 GLUT2 is GLUT আর সেকেন্ডারি অ্যাক্টিভ প্রসেস। ঠিক আছে, এবার এখান থেকে নানা রকম কোশ্চেন আসতে পারে অ্যাপ্লিকেশন বেস। যেমন আমি বললাম যে গ্লুকোজ সলিউশন বা ইয়ে দেওয়ার সময় ওআরএস এ সল্ট অ্যাড করা হয় কেন? Why do you add pinch of salt in ORS? To facilitate sodium dependent glucose transport. ঠিক আছে, তারপরে মনে করো যে কি কি ওই ড্রাগ গুলো আছে যেগুলি which can cause glycosuria. The drugs which can cause glycosuria, তাই না? ওয়ামিন, ফ্লোরিজিন, ডাইনাইট্রোফেনল মানে ডিএনপি। এইটা পার্টিকুলারলি SGLT ইনহিবিটর। ওরাল হাইপোগ্লাইসেমিয়া কি করা হয়? গ্লাইকোসুরিয়া করে। SGLT2 ইনহিবিটর এটা। আর এগুলি মোটামুটি কিডনি 12টা বাজিয়ে দেয়। আর এটা রিভার্সেবল, ওষুধ খাওয়া বন্ধ করলে গ্লাইকোসুরিয়া বন্ধ হয়। SGLT2 ইনহিবিটর, SGLT2 ইনহিবিটর আলাদা করে লিখে দিলাম। এটা রিভার্সেবল, কিন্তু এগুলি রিভার্সেবল নয়। ওই পটাশিয়াম লিথিয়াম ছাড়া বাকিগুলো রিভার্সেবল নয়। লিথিয়াম কোথায় থাকে? কোন ড্রাগে? লিথিয়াম কার্বনেট অ্যান্টিসাইকেটিক ড্রাগে থাকে। তো যারা অ্যান্টিসাইকেটিক ড্রাগ নেয় তাদের গ্লাইকোসুরিয়া দেখা যেতে পারে, কারণ তাদের মনে অনেক সময় লিথিয়াম দেওয়া হতো। লিথিয়াম টু বুস্ট আপ দেয়ার মুড। সেখানে অনেকে খুব ঝিমিয়ে পড়ে আছে, খুব মন মরা, তাদেরকে লিথিয়াম ড্রাগ দেওয়া হতো আগে টু বুস্ট আপ দেয়ার মুড। ঠিক আছে, তো যখন এটা when they found this property of lithium, they started mixing lithium in soft drinks and give it to soldiers for boosting up. So they made a drink and named it in USA. So they added the lithium in this thing, and this is made for soldiers to boost up their mood. Then when the soldiers liked, then it passed on to their family members also. So a lot of people started having the 7-Up with lithium to boost up their mood. Non-alcoholic drink. Later on, they found that excessive of lithium is causing harm. So then they removed that lithium, but kept the name. Now it contains only how much? All right. So that's how the name UP came. ठीक है, ভালো লাগলো?